You wake up, rub your eyes, and notice that familiar, dry, scratchy feeling. You sit down at a restaurant, trying to read the menu, but the letters blur together until you are forced to squint. Or perhaps you are driving at night, gripping the steering wheel tight because the glare from oncoming headlights leaves you blinded and uncomfortable. Many assume this blurry vision is just a normal, unavoidable part of getting older. They believe it is something you are supposed to accept. But I am here to tell you the truth. The truth that most doctors do not take the time to explain to you is this: your deteriorating eyesight is not always just old age. The American Optometric Association is clear about this fact. Once you pass the age of 60, your eyes become significantly more fragile. Conditions like dry eyes, cataracts, macular degeneration, or sudden blurry vision become far more common. Furthermore, the National Eye Institute warns that vision loss among aging adults is rising faster today than at any point in recorded history. What makes this trend especially dangerous is that the underlying damage almost always happens while you are completely unaware. It happens silently while you sleep. At night, when you think your entire body is resting and perfectly repairing itself, your retina is actually struggling. The retina is the highly sensitive tissue lining the very back of your eye that captures incoming light. During those dark hours, your retina does not always get the vital oxygen and essential nutrients it desperately needs to function. The delicate photoreceptor cells that help you see clearly begin to break down silently. Most people do not notice this cellular starvation until the structural damage is already done. So, here is the question I hear almost every single week from worried patients in my clinic. Why is my vision getting blurry, and is there anything natural I can do without depending on expensive pharmaceutical medications or risky surgery? Here is the hard truth about modern eye care. Common solutions like artificial eye drops, constantly stronger glasses, or laser surgery only deal with the surface symptoms. They do not go after the true root cause of your visual decline. That is exactly why the vision care industry makes billions of dollars every single year, while older adults keep struggling. A study published in a major ophthalmology journal in 2023 confirmed what many researchers had been observing for years. Age-related retinal damage almost always begins with silent changes deep inside the eye. I am talking about oxidative stress and chronic low-grade inflammation. These destructive cellular changes are actually most active at night, precisely when your eyes should be doing their deepest repair work. But here is the good news. More recent clinical research has uncovered something genuinely exciting. Certain everyday fruits contain incredibly powerful natural compounds that your eyes are literally craving during sleep. These targeted nutrients can support the regeneration of damaged photoreceptor cells. They can significantly improve blood circulation to the starving retina. They can even slow the progression of macular degeneration, which remains the leading cause of central vision loss in adults over 60. You may be able to support clearer vision naturally, safely, and comfortably while you sleep. My name is Dr. Eric Lawson. I have spent years working with older adults who are serious about protecting their visual independence using evidence-informed, natural approaches alongside conventional medical care. Today, I am going to walk you through 7 specific fruits that research suggests can support overnight eye repair. Before we dive into the list, I would love to know where you are watching from today. Drop your city or country in the comments below. Finally, please understand that everything I share here is strictly for educational purposes. It is absolutely not a substitute for professional medical advice. If you are experiencing sudden vision changes or serious concerns, you must see a licensed professional before making any lifestyle changes. Your eyes are too important to gamble with. Now, let us begin our countdown. Let us start our countdown with number 7. It is a small fuzzy fruit you probably walk right past at the grocery store every single week. I am talking about kiwi. From an educational perspective, it is crucial to understand that eye health is about what happens at the cellular level. As we age, the retina, the delicate part of your eye that captures incoming light, becomes increasingly vulnerable. Oxidative stress accumulates, and the cells physically wear down. Before you know it, you are squinting at street signs or oncoming headlights look like blinding starbursts when driving at night. Many accept this morning blurriness as inevitable, but from a biological viewpoint, that is actual cellular damage, and growing evidence shows we can address it. Kiwi is loaded with two specific nutrients eye researchers keep coming back to, which are lutein and zeaxanthin. Think of these powerful compounds as your eye's natural internal filters. They sit inside the layers of your retina, absorbing harmful blue light and providing a vital shield of antioxidant protection while your eyes go through their crucial nighttime repair process. Beyond filtering light, kiwi contains a naturally occurring amount of serotonin. This serotonin actively supports deeper, more restorative sleep. Deep sleep is the exact time your eyes do their most critical repair work, so the two benefits work together beautifully. The clinical research gives us a grounded, realistic perspective. A study published in the Journal of Nutrition and Healthy Aging found that older adults who consumed 2 golden kiwis daily experienced measurable improvements in visual sharpness. They also reported reduced morning dryness and less eye redness. From an educational standpoint, this is about safely supporting your body naturally alongside your regular medical care. How do you use it? Keep it simple and eat 2 golden kiwis, not green ones, about an hour before bed. Golden kiwis are preferred because they produce less acid and sit easier on your stomach late at night. Here is a professional detail most people miss completely. Do not peel the fruit all the way to the edge. That thin layer of flesh right beneath the skin contains concentrated caffeic acid, a potent antioxidant. Just scoop the fruit out with a spoon, leaving that inner edge intact. Moving right along from the remarkable benefits of golden kiwis, we arrive at number 6 on our list. This is a fruit you probably already love, and that is watermelon. If you have ever wondered why your vision is still blurry an hour after waking up, you will want to hear this from a biological and educational perspective. As we age, our eyes naturally dry out faster, and blood flow to the retina gradually slows down. That reduced circulation is a major physiological contributor to that frustrating morning blurriness that sometimes takes hours to clear. Watermelon is over 90% water, so the hydration benefit is obvious for dry eyes. However, the educational science points to something much deeper happening at the cellular level. Watermelon is one of the richest dietary sources of lycopene. Lycopene is a powerful antioxidant that observational studies link to reduced oxidative damage in retinal cells. Furthermore, research shows that specific compounds in watermelon support nitric oxide production. Think of nitric oxide as a natural messenger that tells your blood vessels to relax and open up. This improves peripheral blood flow, which translates to better oxygen and nutrient delivery to your starving retina during sleep, exactly when your eyes need it the most. So how do you use this effectively? You should enjoy 1 to 2 cups of chilled seedless watermelon about 30 minutes before bed. But here is a crucial educational warning to protect your health. You must skip the salt. Adding sodium can raise intraocular pressure, which medical foundations identify as a significant risk factor for irreversible vision loss. Always prioritize your safety first. Here is your professional tip for this fruit. Do not throw away the rind. That white section near the outer skin contains citrulline, an important amino acid that supports healthy blood vessel function and contributes heavily to nighttime eye nourishment. You can easily blend that white part into an evening smoothie. Are you someone who struggles with dry, blurry eyes first thing in the morning? I would love to hear about your daily experience. Drop a comment below the video and let me know exactly how long it takes for your morning vision to fully clear up. Now, moving forward from those morning hydration benefits, we reach number 5 on our list. This is an item most people have genuinely never purchased at their local store. We are talking about black currants. They are tiny and easy to overlook, but when it comes to protecting your eyes, especially in low-light environments, they are quietly remarkable. From an educational standpoint, we need to look at a specific biological problem called retinal microinflammation. Over time, this chronic low-grade inflammation reduces blood flow to your optic nerve. It is the exact process that blurs your vision, creates those frustrating halos around headlights at night, and causes progressive eye strain in dim conditions. These are structural cellular problems that simply getting a stronger glasses prescription cannot fix. What makes black currants so medically fascinating is their extraordinary anthocyanin content. Anthocyanins are the deep purple pigments giving these berries their rich color. In the human eye, they perform several vital functions simultaneously. They calm internal inflammation and support blood vessel dilation. Most importantly, they help restore rhodopsin, which is the specific visual pigment responsible for your eye's ability to adjust from bright light to complete darkness. Clinical research provides a very solid perspective here. A randomized controlled trial found that 50 milligrams of blackcurrant anthocyanins daily significantly improved blood flow to the optic nerve head. It also meaningfully slowed the progression of visual field loss in participants over 24 months. Another pilot study showed increased retinal blood flow without artificially raising eye pressure, pointing to genuine neuroprotective potential. For seniors who struggle with driving at night or moving between rooms with different lighting, this information is directly relevant to maintaining your daily independence. Because fresh black currants are notoriously hard to find in most standard grocery stores, your best educational approach is looking for a standardized extract. You want about 50 milligrams taken daily in the evening alongside your other fruits. Here is your professional tip for maximum absorption. Always pair this extract with a small amount of healthy fat like a few walnuts or a natural vitamin C source like a fresh slice of orange. Nutrient synergy genuinely matters when repairing cellular damage. This simple daily addition could be the missing key to feeling confident and safe on the road again. Moving from the remarkable benefits of black currants, we arrive at number 4 on our list. This is a fruit you almost certainly already have in your kitchen right now, and that is blueberries. But here is the educational part that surprises almost everyone. Most of us eat blueberries in a way that actually cancels out a significant portion of their eye protective benefits. From a physiological perspective, we need to understand what blueberries actually target in the eye. They specifically address oxidative damage in your photoreceptors. These are the specialized cells in your retina that allow you to focus, distinguish fine detail, and adapt to changes in light. Over the years, natural antioxidant defenses gradually thin out. Slowly, you start squinting at text, struggling in dim light, or asking yourself why your vision remains blurry even with your glasses on. The primary compound in blueberries is pterostilbene, which is chemically related to resveratrol, but is significantly more bioavailable. Educational research suggests it can effectively cross the blood-retinal barrier and act directly on cellular damage in light-sensitive tissue. That is a highly meaningful distinction from most dietary antioxidants that simply never reach the tissue that needs them the most. A 2023 study published in Nutritional Neuroscience found that older adults who consumed wild blueberries daily for 12 weeks showed notable improvements in visual acuity. They also reported meaningfully less eye strain when viewing digital screens in low-light environments. But here is the critical educational detail. Not all blueberries deliver the same biological benefit. The large, shiny, cultivated varieties commonly sold in supermarkets have measurably lower antioxidant density. Wild blueberries, which are the small dark ones you typically find in the frozen section, carry nearly double the concentration of active compounds. Frozen is just as effective as fresh. How do you use them correctly? You should eat about 1/3 cup of wild blueberries 45 minutes before bed. And here is the professional tip that most people get wrong. Do not combine them with dairy. The proteins in milk bind to anthocyanins and physically block their absorption in your gut. Instead, lightly freeze and then thaw your blueberries before eating. That simple process breaks down cell walls and dramatically increases the bioavailability of the antioxidants, so your eyes can actually access them during overnight repair. Continuing our focus on maximizing your eyes overnight. Cellular repair, we arrive at number 3 on our list. This next fruit often surprises almost everybody. We are talking about dragon fruit. It is exotic and visually striking, but from a clinical and educational perspective, it may be one of the most effective natural tools for increasing oxygen delivery to your eyes while you sleep. If you regularly wake up with tired, heavy eyes, even after a full night of rest, you need to pay close attention to the science here. You have likely seen dragon fruit in stores with its bright pink skin. But the variety matters enormously for your vision. You must choose the deep red-fleshed variety, because the white ones do not contain the specific compounds we are after. The medical issue this red fruit addresses is called retinal hypoxia. In simple terms, retinal hypoxia means your retinal tissue is silently starving for adequate oxygen during the night. When this happens, you can sleep a full 8 hours and still wake up with fatigued, heavy eyes. Your peripheral vision might start to blur, and colors may look flatter than they used to. What makes red dragon fruit so powerful is its high concentration of betalains. These are unique antioxidants that clinical research shows can actively support nitric oxide production in your blood vessels. Nitric oxide is the molecule that relaxes and widens your capillaries, including the microscopic ones supplying your retina. Wider capillaries mean significantly more oxygen, and nutrients reach your eye tissue during deep sleep. A 2022 study published in Frontiers in Aging Biology reported that participants who consumed red dragon fruit extract showed meaningful improvements in ocular circulation and visual field depth. In practical terms, they could see more clearly in low light and reported noticeable reductions in blurry vision. How do you use it effectively? Eat half of a red-fleshed dragon fruit about an hour before bed. And here is the professional tip that almost everyone misses completely. Do not swallow the tiny black seeds whole. You must chew them. Those seeds contain valuable omega-3 fatty acids and magnesium, which both play documented roles in retinal nerve health and repair. If you swallow them whole, you lose almost all of that biological benefit. Moving forward from the oxygen-boosting power of dragon fruit, we arrive at number 2 on our list. This fruit has thousands of years of history, but modern science is finally explaining exactly why it works. We are talking about goji berries. These bright red, slightly sweet berries have been used in traditional practices for over 2 millennia, specifically for eye health. Today, the evidence is clear, and it targets a specific biological problem called macular thinning. From an educational perspective, you need to understand your macula. The macula is the central zone of your retina. It is completely responsible for the sharp, detailed vision you use to read, recognize faces, and see colors with absolute clarity. As we age, oxidative stress and reduced circulation naturally degrade this crucial tissue. This deterioration is the foundational process behind age-related macular degeneration, which remains one of the leading causes of irreversible vision loss worldwide. What makes goji berries medically exceptional is their massive concentration of zeaxanthin. While lutein primarily protects the outer regions of your retina, zeaxanthin concentrates directly in your macula, your absolute center of vision. This targeted cellular protection is vital. A 2021 clinical study published in Nutrients followed adults aged 60 to 80. Those who consumed dried goji berries 5 days a week for 90 days showed a significant increase in macular pigment optical density. In practical terms, this means their eyes built a thicker protective shield and their macular health remained stable. How do you use them correctly? Soak 2 tablespoons of dried goji berries in warm water for 10 minutes and eat them 30 minutes before bed. Soaking softens the berries and vastly improves digestibility for older digestive systems. Here is your professional tip backed by genuine nutritional science. Pair your soaked goji berries with a small square of high-quality dark chocolate containing at least 85% cacao. The flavonoids in the cocoa physically enhance your body's absorption of the zeaxanthin, creating a biological synergy your macula can actually use. If you find this scientific approach to eye health valuable, please hit the like button and subscribe right now so you never miss future educational videos. And finally, we have reached number 1. The fruit that tops this entire list for protecting your eyes is not exotic, and it is not expensive. You may actually have one sitting on your kitchen counter right now. We are talking about papaya. When you eat it correctly, it targets one of the most destructive and most overlooked processes behind blurry vision, cloudy lenses, and early cataract formation. From an educational perspective, we need to look at a specific biological enemy called glycation. Glycation is the process by which excess blood glucose slowly binds to proteins in your eye tissue. This forms advanced glycation end products which progressively cloud your lens and degrade your retina over time. It is one of the most underappreciated contributors to age-related vision deterioration, and it is happening silently and continuously in most people over 60. Papaya is medically fascinating because it is rich in papain, a naturally occurring enzyme with documented anti-inflammatory and protein-modifying properties. It also delivers a powerful combination of vitamins A, C, and E, alongside essential folate. A 2023 clinical study found that older adults who consumed papaya in the evening showed lower levels of glycation markers in follow-up testing. They also demonstrated stronger tear production and measurable improvements in contrast vision within 6 weeks. For seniors dealing with dry eyes, blurry morning vision, or early-stage cataracts, these are highly meaningful clinical outcomes. So how do you use it properly to support your ocular health? You should enjoy 1 cup of ripe, fresh papaya cubes about an hour before bed. But here is the critical educational detail you must follow. Fresh is always better than processed, and room temperature is absolutely essential. You must take your papaya out of the refrigerator at least 30 to 60 minutes before eating it. Cold temperatures actively suppress enzyme activity, and you want that papain at full biological strength when it reaches your digestive system. Furthermore, never pair it with dairy to avoid blocking absorption. Here is your ultimate professional tip for this #1 fruit. Squeeze fresh lime juice directly over your papaya cubes just before eating. The high vitamin C content in the lime meaningfully boosts your body's natural absorption of the vitamin A inside the papaya. Your eyes get significantly more of the nutrients they desperately need for overnight cellular repair, and it tastes considerably better too. Now, before we wrap up our discussion on these 7 incredible fruits, there are 5 absolute rules I need you to hear and understand from an educational standpoint. Without these 5 foundational principles, you could eat every single fruit on this list perfectly and still not get the full biological benefit your eyes desperately need. Rule 1 is crucial. Do not combine your fruit with high-calcium foods. If you eat your papaya or blueberries shortly after consuming milk, yogurt, or calcium-fortified cereal, you are actively blocking your body's absorption of lutein and zeaxanthin. Research clearly shows that high-calcium meals can reduce the absorption of these key eye nutrients by up to 30%. Give yourself at least 90 minutes between any dairy and your evening fruit to protect that absorption process. Rule 2 requires you to always add a small amount of healthy fat. From a physiological perspective, most of the key antioxidants in these fruits are completely fat-soluble. Your body literally cannot fully absorb them without fat present. Adding a few walnuts, a teaspoon of flaxseed oil, or a couple slices of avocado alongside your fruit can boost absorption by more than 50%, according to published nutritional research. Rule 3 is to wash your fruit gently. This specific detail often surprises people. Aggressive scrubbing under hard running water physically removes a significant portion of the surface antioxidants, particularly on blueberries and black currants, where the protective compounds are concentrated near the skin. Just rinse them gently under cool water right before eating. Rule 4 is prioritizing room temperature over cold. As we discussed with papaya, refrigeration actively suppresses the enzyme activity in several of these fruits. Below a certain temperature, these beneficial enzymes lose their functional healing activity. Always take your fruit out 30 to 60 minutes before eating, so your body can extract maximum cellular benefit. Rule 5 is that timing is everything. You must eat your fruit 60 to 90 minutes before going to bed. If you eat it too early, the nutrients are metabolized and cleared before your eyes enter their primary overnight repair window. If you eat it too late, active digestion will disrupt the deep restorative sleep your eyes genuinely require to heal. Hit that specific time window, and you give these natural compounds the best possible chance to support your vision safely and effectively. So let us bring everything together into one clear perspective. The most important educational lesson I want you to take away is that blurry vision is not simply an inevitable consequence of aging that you must passively accept. As we have explored, it is often the direct result of specific identifiable biological processes happening silently inside your eye tissue. We are talking about oxidative damage, chronic inflammation, poor circulation, and glycation. However, growing clinical evidence suggests that by introducing these specific fruits into your evening routine, eaten at the right time and in the right way, you can meaningfully support your eye's natural overnight repair processes. Think about the real value here. This is about reading a book without constantly squinting. It is about driving at night without that anxious grip on the steering wheel because the glare is blinding. It is about waking up in the morning and seeing clearly within minutes, looking at the faces of the people you love, and seeing every single detail. That is what this journey is truly about. It is not just about achieving clearer vision, but maintaining your daily independence, your confidence, and your overall quality of life as you age. Please remember, this information is strictly for educational purposes and should never replace professional medical advice from your doctor. Always consult your eye care specialist for your specific health needs. I really want to hear from you right now. If your eyesight became noticeably clearer tomorrow morning, what is the very first thing you would want to look at? Is it your family, a beautiful sunset, or your garden? Leave your answer in the comments below because I read every single one. If you found this educational approach valuable, please hit the like button, subscribe to the channel, and share this video with someone over 60 in your life. You might genuinely make a difference for them. This is Dr. Eric Lawson. Take care of your eyes, they are irreplaceable, and I will see you in the next video.